Today, we have damning new evidence of the lengths that the UCP will go to privatize our public health care. We are releasing documents from the AHS acquired through a Freedom of Information request that show that the UCP is scheming to send Alberta patients to a surgical facility in British Columbia over the strenuous objections of surgeons and clinical leaders in Alberta. Starting in the fall of 2021 and into the spring of this year, the UCP compelled AHS to enter into contract negotiations with the Okanagan Health Surgical Centre in Kelowna, British Columbia. Turns out that sending someone to another province to have their knee or hip replacement is actually not as simple as it sounds, as you will see when you look through the 400 pages of FOIP documents we're releasing today. Major surgeries involve a great deal of preparation work with a patient and also post-operative support. Ordinarily, as a result, one surgeon would see the entire process through from beginning to end. So it would be a very serious disruption to that continuity of care to have a different person do the part in the middle, the surgery, without having done any of the preparation and without taking any responsibility for care after the surgery. And so this plan for out-of-province surgeries had to be amended, and it became something even more completely absurd. Here we go. See if you can follow along. An Alberta patient with their Alberta surgeon do the prep work for the surgery in Alberta, and then they get on a plane and they travel together and stay in BC in order to get the actual surgery completed. And then they travel back to Alberta together afterwards for the post-surgical care. Not surprisingly, this adds a huge amount of totally unnecessary costs and delays and scheduling problems. It is also limited to the small number of surgeons who are licensed to practice in both Alberta and BC. Quite frankly, the whole plan is utterly ridiculous. Well, to be very clear, they got the negative feedback repeatedly, as far as we can tell, in this FOIP in the fall of 2021. And what you see is that notwithstanding the negative feedback, where the FOIP leaves off is there is absolutely no indication that they're not planning on going ahead with it. Moreover, there is indication that Jason Copping's office lied to the media about the state of play with respect to the plans. So again, we don't have all the information. What we do know is that the UCP has not been open with Albertans. And moreover, sending surgeons on a plane outside of the province to a slightly less than reputable private surgical facility is not building surgical capacity. It is reducing the effectiveness of that surgeon. It is costing us a lot more. It is ridiculous. It is just ridiculous. It is ideological and nothing else.